The evidence is solid that patient engagement improves outcomes and reduces costs. And so the way that patients become engaged with these digital tools is they use them and the data to help guide them in the self-management of their own health. So that's one piece. And then the second piece that you can do with the data is you can create data analytics to be able to predict events early. You wouldn't have seen the indicators looking at the data on a day-to-day basis. By providing analytics, you can predict things that might happen where you can intervene early. The reason that we have to do that is because we have to get the products in the hands of the users so that we understand what's working and not working so that we can iterate continuously to improve the product. The dilemma for us is that our processes in the VA have not been set up for continuous release cycles. And we're working on that, but that has been a challenge. I think that we will be successful when we're improving healthcare because we have the data we need to improve healthcare. And that data is a set of complete, longitudinal, real-time data about the patients that we take care of. The situation that we find ourselves in right now in healthcare is information is siloed, and it's not shareable, and it's not interoperable. And as a result, we end up with fragmented information that leads to adverse care being provided. Two ways we fix it. One is we get all the data from the healthcare systems to be interoperable and exchangeable. And the second way we fix it is we get patient-generated data, the data that they're collecting on their digital tools, to be able to also be shared with their healthcare teams, to be standardized and exchangeable. And with that data, you now can improve healthcare. The data supports patient engagement. So our Office of Connected Care is the home of the VHA Innovations Office. And we also work with a lot of the other VA initiatives in innovations. So we approach innovations at two levels. We approach it at the local level, where we have frontline clinicians, frontline workers with lots of great creative ideas on how to make things better, and they should know because they're doing the work. And we gather up those ideas and we take the good ones and we fund them and support the people to bring those ideas to fruition. The other way we do innovation is we engage the private sector. We go to companies and we say, we have a problem, help us solve the problem. For example, we have a product called ReachVet, where we engaged a private sector company on using predictive analytics to predict patients with a high risk of suicide. I'm told pretty accurate at predicting that, and we can intervene with those patients. Another example that came from the private sector is we have a product called Revamp, which is a mobile app, and it's used to treat patients with chronic sleep apnea, which is the third most common chronic condition that we have in the VA. And the beauty of this is that a patient can be in their home, they can attach their CPAP machine to a mobile app through Bluetooth. The CPAP machine sends the data to the mobile device and then to the sleep team, who might be hundreds of miles away. The sleep team can then manage and diagnose the condition from far away. This is wonderful because many of our patients are in rural areas, and this is an example of how we're providing virtual care and improving access. We know that we need really good products for them to be adopted. They have to work well, they have to be easy to use, and there has to be support for the end user. We know that. Our strategy is to focus on products that we believe the providers will see value in. And the reason that we do that is we know that one of the key drivers to adoption of technology by patients is that their providers encourage them to use it. There's a huge demand for our anti-text messaging application. And the reason it is because providers see value in that product. They see that it is going to increase the patient's ability to care for themselves and increase the connection of the team. And we know this strategy has worked before. We have 1.5 million users of our secure messaging application. And the reason for that, in part, is because the providers have encouraged the patients to use it. So we know that this strategy of focusing on providers and asking them to encourage patients to use it is a way to get our technology adopted.